Between here and Athens, he was across the bay, there's something between me and Athens. There must be something. I think it's something. And he was right. It's air. It's air. And if you put air in a tube, what do you have in the tube?
Air.
Yeah, but what's the element? Oxygen.
Oh.
Oxygen. We're breathing it. Well, some of us are breathing it, I think. Of course, we're all breathing it. Okay? But when the tissue gets diseased, like the tiny little arteries in the tissue, of the lung tissue, and they get tighter and tighter and tighter and tighter. In other words, those tiny little arteries that are in there. Now I'm going to blow up this little artery. Let's pretend like this artery's right here. Now I'm going to blow it up a little bit for you. And this is a normal artery. This is an alveoli, and this is an artery, okay? Something like that. I'm not an artist. What I'm trying to depict is, this is the endothelium, this is the muscularis, and this is the abdomen tissue, right? Well, in pulmonary hypertension, something happens to the artery which it keeps getting smaller and smaller and smaller and smaller and smaller, till finally the artery is obliterated or destroyed or damaged. And what happens to the blood pressure on the right side of the heart? When the blood's going out into the main pulmonary artery and eventually gets to an alveoli, what happens? It goes up. Hypertension. Now, who got a blood pressure reading sometime in the last year? Yeah, all of us did. Right. You get a little blood pressure, right? On which side of the heart? The left side. So how can I get a blood pressure cuff and go up to this nice young lady and say, I'm going to take your blood pressure and your lungs. Whoa! Whoa! Please, you know, that's open heart surgery. I'm going to get inside your lung. I'm going to put a little cuff around one of the arteries. No. That's not the way you take blood pressure. It's inferential. So the definition is progressive, unrelenting, progressive disease within the small arteries of lung tissue. And what's lung tissue? It's interstitium. Most of it is air, but it's just interstitium. It's the alveolum. Okay? That's the definition. Now, what happens when these tiny little alveoli, arteries start getting obstructed? Well, blood's trying to get into the tissue, and all these arteries are getting blocked. What happens on the right side of the heart, or on the pulmonary side? The blood pressure starts going up. And if that happens, what happens in the right ventricle? Okay, I want you to think about that a little bit. We'll come back to it just a bit. So that's the basic definition of your pulmonary hypertension. Any questions? Pretty straightforward. So let's go over symptoms. So if the arteries in the lungs start clogging up, they start constricting, start strangulating the lungs. You have lungs on both sides of your chest, right? Right? Definitely going to make a little area for the heart. These are the lungs. So essentially what happens is, as the blood pressure starts going up on both sides, it's like you're constricting the whole thing there, right? What would you think would happen to a patient that suddenly is getting constricted in the lungs? What's the number one symptom you might have?
Shortness of breath.
Shortness of breath. Straightforward. Once you understand the definition, from this point on, you will understand that the state of pulmonary hypertension makes sense. It's not rocket science, it just makes sense. When you're thinking of pulmonary hypertension, you see those little arteries starting to constrict. You can see the lungs physically, mentally, if you will, start to strangulate. The patient's going to have shortness of breath. But it's from a different reason now, right? Because you and I think, well, they're short of breath because it's a COPD or a left heart failure or something else going on with the coronary arteries. We're talking about pulmonary hypertension. So you see how I have put you on the right side of the heart, inside the lungs, into the interstitium, giving you the same symptoms that you would have from something else. So you, as a respiratory therapist, have to keep that mental agility that just because the patient has shortness of breath, don't jump to the fact that it's COPD and just a straightforward left heart failure, congestive heart failure. Okay? So you need to have that mental agility. So shortness of breath. The next one would be fatigue. How many people are fatigued? Everybody raise their hand. Everybody. We're all fatigued. Tired of being on this room. My butt's getting sore. Let's get home. Margaritas in about, well, it's 5 o'clock somewhere, okay? All right? So fatigue. Fainting spells and dizziness. When I was going through my training in Baltimore, how many people come up to you and say, I feel a little dizzy? Do you jump to pulmonary hypertension? Of course not. But you have to keep that in mind when you're dealing with a young lady or with an elderly gentleman or an elderly female who's on medications. And you're thinking, well, it could be part or at least a consideration. Chest pressure, chest pain can be part of it. Swelling or edema of the legs. Starts with the ankles, the legs. It can actually lead to ascites, fluid in the abdomen. You can have bluish lips, cyanosis. You can have a tachycardia or palpitations. The patient feels they have palpitations. A racing heart. Once you know the definition of it, then the symptoms make sense. So the patients come to you with shortness of breath. Now you're considering the possibility of pulmonary hypertension. And the next thing you start thinking, well, what would be the cause of it? Remember I told you that the lungs are being strangulated and the blood pressure starts going up and the right side of the heart starts to what? Pump a little harder to get the blood into the lungs, into arteries that are getting tight. What happens to the right heart muscle at the beginning? It gets a little thicker. Like when those of us who want to look like Arnold Schwarzenegger, we start exercising, we want our muscles big. That's what happens to the right ventricular muscle. And if you look at a model, it's actually quite thin. But at the beginning of pulmonary hypertension, it gets thick. It tries to adjust, tries to accommodate for the resistance that it's feeling. Can it do it forever? No. Eventually you get right heart failure. Cor pulmonale. And that's where the old term cor pulmonale comes from. It's right heart failure. But it's so ingrained in us, and we've seen so much of this right heart failure that people who've seen it, they just call it cor heart pulmonale, lung failure, because of high blood pressure in the lung. Okay? And then what happens when it starts failing is it starts pushing fluid up into the right atrium, right? Causing TR.